All right, hi everybody. Thank you so much for joining us for today's presentation. My name is Susie Rumor and I'm the chair of the Build Well Committee, which is part of the TW's Health and Wellbeing Initiative. So Build Well focuses on how physical spaces around us impact our health and well-being. And I want to thank Build Well Committee members led by Dr. Wouter van Erve for organizing this event. And thanks also to Dr. Michelle Kelly-Reeves and her team from the Health and Wellbeing Initiative for their support, including marketing. So today's presentation is titled Your Health and the Built Environment, an overview of the research and strategies for future policy action. In this interactive session, you're going to learn about how the places where you live, learn, work, and play influence a wide range of health risks and outcomes. You'll also learn some things that you can do in your professional and private life to make your community healthier and more equitable. Our speaker today is Martha Fedorowicz. Martha is a policy associate in the Research Action Lab at the Urban Institute, where she works with local government agencies, philanthropic organizations, and nonprofits to deliver technical assistance and translates research into practical tools for policymakers. Before joining the Urban Institute, Fedorowicz was a special projects administrator with the City of Lansing's Department of Neighborhoods and Citizen Engagement, and a summer policy associate in the City of Detroit's Department of Neighborhoods. Fedorowicz is a graduate of the University of Michigan's Gerald R. Ford School of Public Policy, where she specialized in neighborhood development, local government innovation, civic engagement, and housing policy. Fedorowicz has a BA in political science and French from the University of Michigan and served as a youth development Peace Corps volunteer in Morocco from 2012 to 2014. Thank you, Martha, for being with us here today. And with that, I will hand it over to you.
Thank you so much, Susie. I appreciate that really warm introduction. Let me share my screen here. All right, can everyone see that okay? Excellent. So as Susie said, my name is Martha Fedorowicz, and I'm a policy associate in the Research to Action Lab at the Urban Institute. We are a nonprofit social and economic policy research organization located in Washington, D.C. I'm so honored to have been invited to give you this presentation today. Thanks especially to Dr. Wouter van Erve and Susie Rumor for inviting me to be here. So just to give you an idea, my goal for today's presentation is really to give you a basic understanding of what the built environment is, how it impacts health and your health specifically, and the health of other people in your community. And how it came to be the way that it is, and how you as students, as faculty, and as future professionals can take action to improve the built environment for everybody. So for my agenda, I have 5 main parts for today. I'll briefly go over the concept of social determinants of health, and then we'll do a deep dive into the built environment, which is one of the 5 social determinants of health. Next up, we'll talk about the extremely important topic of health equity, and we'll learn how past and present policies and plans have impacted the way that our built environment is now and how it impacts health, especially among different groups of people. I'll then give you a chance to apply some of your learning and ask you to share some of the ways that health, specifically the built environment, how it's impacting your health today. Throughout my presentation, I'm going to be using a tool called Jamboard to get all of you to participate. And I'll give you a brief tutorial in case you've never used it before, just to show you how that works. And then finally, I'll close my presentation, as Susie mentioned, by talking about how you can take action either as a professional or as an individual, just resident living in your community, to improve the built environment and create better health outcomes. All right, so diving in, we're going to get our first chance to use the Jamboard today. So if you've never used Jamboard before, it's a Google product. It's basically like an online whiteboard that you can put sticky notes on. So I'm going to show you how to use it in just a moment. But the first thing I wanted to do was to present the question we'll be discussing, which is what factors influence health? So keep that question in your mind. What factors influence health? So if you've never been on Jamboard before, when we share the link in just a moment, this is what you're going to see when you click it. So in the middle, we have this big white space. That's the whiteboard where you're going to put your idea. There are 3 features for you to know today. The first is that I've set up multiple frames for us to use. So a frame is basically a different board for every question. And you can toggle between each of the boards by clicking the arrows in the green box, as you can see in my picture here. So I'll tell you, depending on which question we're answering, I'll say toggle to the next board or toggle to the next question. So that's at the very top in that green box. Then, because there are many of you here today, I created 3 boards for each question, and I've labeled those by which letter of the alphabet, so for your last name. So if your last name starts with A through I, you'll look for the slide that has the A through I in the top right corner. There's also J through R and S through T. So you'll just, again, use those arrows at the top, toggle to the frame that has the letters pertaining to your last name on it. So if Voter or Susie could put the Jamboard link in the chat, wonderful. There it is. So everyone, if you could just click onto that Jamboard now. And so the first thing that I want you to do is go ahead and go to the correct frame for your last name. So again, use those arrows at the top of the slide and move to the ones that has the letters with your last name. And it should be one of the first 3. So then the next thing you're going to do is add your sticky note. So if you click the sticky note icon on the left, in my slide here, it's in a little red box. That's going to pop up a sticky note on your screen, and that's where you can type your answer. You can change the color of the sticky note if you want to. And then once you type your answer, you can click save and the sticky note will go on the board. You are limited by letter count, so you want to keep your responses somewhat short. And after you hit save, if you decide that you want to change your answer, you just go back to the sticky note, you click the little 3 dots in the upper right-hand corner, and you can edit your response. So with that, what I'd love for everyone to do, if you haven't already, is go ahead and answer our first question, which is, what factors influence health? And I'll just give you a moment to answer. All right, I see a lot of answers. This is great. All right, the water you drink, yes. Socioeconomic status, stress, wonderful. Diet and fresh veggies available to you, absolutely. Sense of place, space, air quality, salary. Okay, I can see we've got some experts in here. Waste removal, that's great. Cultural environment, access to health services, air quality, genetics and environmental influences. Yep, policies, programs, physical environment, being able to get to work safely without using a car. That's a great one. Food and beverage options, access to medical care, sense of place. This is great. All right, that was really wonderful. You guys were excellent. So we'll definitely be talking more about each of these in my presentation. So let's go to our next slide. So wanted to talk today a little bit about social determinants of health. So a lot of the things that you all just named in those sticky notes, those are social determinants of health. So the Centers for Disease Control and Prevention define social determinants of health as the conditions in which people are born, grow, live, work, and age that impact someone's health. Social determinants of health are shaped by the distribution of money, power, and resources throughout local communities, nations, and the world. Differences in these conditions lead to health inequities or the unfair and unavoidable differences in health status seen within and between countries. So this is a diagram from the CDC's website. Hopefully some of you have seen this before. So these are our 5 categories that are recognized as making up the social determinants of health. So we have education, access, and quality, healthcare and quality. This is one of the determinants that many of you might be working in. Neighborhood and built environment, social and community context, and economic stability. So of course, all of these influence our health in different ways. So now what I'd love to see, we're actually going to use the Zoom chat for this, not the Jamboard. So just in the Zoom chat, my question for you all is, how might education access and quality influence someone's health? So take a moment and in the chat, go ahead and put your answer, how you think, how might education access and quality influence someone's health? Lack of knowledge and literacy levels. Have information needed to make good decisions, broadens professional options, influencer education is power, better decision making, access to resources. Yep. Access to those with the same likes and dislikes, likely to have higher income. Yep, that's a really important one, right? If you have higher income, you're likely to have more opportunities to achieve better health. That's great. So, yeah, as you might have guessed, more education typically leads to better paying jobs, to jobs that are more likely to have health benefits, like health insurance. Which, and health insurance, of course, promotes positive health and the ability to afford a nicer home. And we'll talk about a little later how a nice home can create positive health outcomes. So just one more of these, again, place your answer in the chat. How does the social and community context influence health? How does social and community context influence health? This is just any guesses. Positive support, absolutely. Activism, yep. I love that answer. Resources and support. Quality of relationships impact mental health, absolutely. Promotes more activism, gives people a sense of belonging. Yes, this is perfect. You guys are great. So as some of you said, having friends and family who you have good relationships with, having people who can help take care of you, having strong supportive networks, all of that can promote positive mental health. In another really practical way, let's say you don't have a car. If you have good social connections with someone that you can call up and say, hey, I need a ride. I need help getting to my medical appointment. That's another thing that can help promote positive health. So thank you all for participating in that exercise. So just to share, we're going to dive in a little bit more now to the built environment. So this is a graphic that I found on the Harris County, Texas website to symbolize the built environment. And how they define built environment is human-made design and layout of communities in which people live, learn, work, worship, and play. So the built environment is made up of lots of different things. We've got workplaces, trails, housing, parks, sidewalks, streets, infrastructure, buildings, and vacant properties. So all of these things that you're walking down the street, you pass them every day, they're under your feet, you see them as you go to work and go to school. All of these things are part of what we call the built environment. So before I go any further, I just wanted to start out by saying that some of the stuff that I'm going to be presenting about today, particularly in regard to health inequities and how they came to be in the United States, I wanted to take a moment to acknowledge that this is a heavy topic. This might be really difficult for some folks to hear, especially if it's your first time learning about this topic of health inequities, or if you're experiencing some of the challenges that I'm talking about today, if you've experienced structural racism, discrimination, or health inequities. I know that some of what I might be presenting might be difficult to listen to. And so I just wanted to take a moment and acknowledge that up front. My goal with this presentation today is really to educate all of you about how these inequities came to be and how you as residents, as students, as faculty members, as future professionals, how you can really change your community for the better to really improve health and well-being for all people and to eliminate racial inequities. So at the end of my presentation, I'll share some ways that you can take action, and I would definitely encourage you to learn more if you're really interested in this topic. But just wanted to start out by saying, if you need to step away for a moment at any point during the presentation, please do, and I hope you'll come back to us when you're ready. So with that, the reason that I was invited here today, in 2020, my colleagues and I researched and wrote a paper called Leveraging the Built Environment for Health Equity. It was a partnership with the Pew Charitable Trust and was funded by the Robert Wood Johnson Foundation. Our goal for the research was really to help cities and counties across the country understand what different built environment factors influence health, how they can influence someone's health, either by harming health or by promoting better health, and then offering solutions that policymakers and practitioners can use to improve health outcomes in their community. We also had a specific focus on health equity, and as I said before, I'll return to that later. So in our research, we sought to take a look at all of these different built environment interventions that we were seeing across the country and categorize them so we could help organize and help people understand how to think about them. So we ended up organizing them into 6 different policy domains: safe, healthy, and affordable housing, active living assets and facilities, regional and local infrastructure, food security, health and nutrition, vacant property reclamation and urban greening, and neighborhood and community design. And so for my presentation today, we're going to do a deep dive into just 2 of these. I would love to talk your ear off for hours and hours and be able to cover all of these in depth, but because we have limited time, I'm going to focus on these 2 just to show you, from a research framework, how you can think about the different elements in each of these built environment policy domains, and then you can go and learn more about the other ones. So these are the 2 I'll focus on today. So let's start with housing. So in recent years, housing has really emerged as one of the most talked about and researched social determinants of health. This is because several decades of research examining the impact of toxins inside the home, in particular lead paint, and the impact of lead paint on children's health, have really highlighted the connection between housing quality and health in communities across the US. So it took a long time for the research on the impact of lead paint and lead in drinking water to really build up enough for scientists, medical professionals, people in the policy and planning fields to say, we now understand that there is a very strong link between a person's housing and how healthy they are. So I want to go back to the Jamboard. So if you could click on the Jamboard link again, if you don't still have it up, or maybe Dr. Van Erve or Susie can share the link again for us if you're just joining us. And I want you to toggle to the slides, to the frames that say, how do you think housing impacts health, either negatively or positively? So if you could click the Jamboard link, again, find the slide that says, how do you think housing impacts health, either negatively or positively, and reply on the slide that has your last name, the initials for your last name. All right, old housing could contain more toxins not used in newer housing, absolutely. Can make you feel either safe or stressed, yes. Can give people a safe space to recharge and unwind, absolutely, that's great. Lead paint, mold can impact respiratory health, yes. Lack of home increases homelessness, yes. Provides protection from extreme environments. House size, both positive and negatives. Yep. Safe neighborhood and safe housing helps in shaping a child's physical, mental, emotional, and social health. Yep, this is great. Poor insulation and water quality, security, what people put in homes, outdoor space, cost of housing. Absolutely. I'm so happy to see someone mention cost here. Windows and sunlight. That's great. Can make you feel financially unstable. Cost of living. Yep, this is excellent. Thank you all for doing that. So let's go back to my slides now here. So based on our research, we identified 3 main categories of the ways in which housing can influence health, and you all got most of these. So the first category is quality and accessibility. The second category is location. And we often forget this one, but a couple of you got it. So I was really happy to see this, but how affordable someone's housing is can also impact health in many ways. So as an example, I'm going to dive a little bit deeper into each of these. Some of this might seem quite obvious to you, and you're going to nod your head and say, yep, I know that. Hopefully some of this is also new, and I'll present a little bit about the research and what it says about the connections between these different elements in health. So what are some housing hazards that impact health? So you guys already named a couple of these on the Jamboard. So hazards like mold, asbestos, lead paint, poor ventilation systems, inadequate housing conditions like pest infestation, crowding. So that's when too many people are living in a housing unit that's not really big enough for that many people, broken plumbing, and the presence of toxic chemicals and pollutants are all linked, as some of you said, to respiratory and infectious diseases, as well as to psychological disorders. Similarly, if a home is not accessible to someone, so for example, if there's someone who is in a wheelchair, if that house doesn't have no-step entryways, if it doesn't have doorways that are large enough for a wheelchair to get through, if it doesn't have fixtures, lights and doorknobs that people in wheelchairs can reach, or ramps to be able to get up into the house, then that definitely can influence whether someone with a physical disability can access the things in their home that they need to be safe and healthy. There's also a growing body of research that shows that poor housing quality near you, so not even if your house is great, but there are houses near you that are blighted, abandoned, or of poor quality, that can also negatively impact your health. So just some of the research on housing quality and health, just to show you some examples. So in this first study on the left, the researchers wanted to understand if the 2008 housing crisis exacerbated cardiovascular health factors in Latinx populations. And what they found was that there was a significant association between foreclosure risk in someone's neighborhood with hypertension and hypercholesteremia. I'm not sure if I'm pronouncing that right because I'm not a medical professional, but they found this among Latinx renters in particular. Interestingly, they did not find the same risk of cardiovascular disease for Latinx homeowners. So they believe that the reason this association was particularly acute for renters is that renters are more vulnerable to negative health effects in high-risk foreclosure areas. In the second study on the right, researchers in Spain investigated chemicals known to have adverse health effects in schools and homes to learn how many indoor pollutants children are inhaling. They knew that there is a lot of work to keep schools and air quality in schools clean, but they were concerned that houses have much worse pollutants and worse air quality than schools do. And that is in fact what they found. They found that there were higher concentrations of indoor air pollutants in homes than in schools. And in fact, homes were responsible for 88% of the pollutants analyzed, so quite a high number. So a home's location also has implications for someone's health. So again, some of this is pretty obvious. If you live closer to a grocery store, if you live near jobs, near high quality parks, near clean transportation options, all of that can promote positive health. While living near high crime areas living near neglected parks, violence, floodplains, and pollution emitting transportation, and factories can be harmful to health. So for example, living near pollution emitting transportation and factories can cause respiratory diseases like asthma and bronchitis. Living near high crime areas and violence has been connected to high levels of stress, trauma, anxiety, and depression among residents. And of course, living near grocery stores and parks can promote positive fitness and healthy eating. And as some of you might guess, living near parks can also lead to more social interaction, which is good for mental health. So last up is affordability. And as I said before, I was super excited to see some of you put this in the Jamboard, because this is the one that people don't think about quite as often, but there's been a lot of research lately which points to how housing inaffordability can lead to negative health outcomes. So inability to pay rent each month, of course, can force families to move a lot. Frequent moves, housing instability have been linked to gaps in insurance coverage among children, not having a usual source of care. So if a family is moving a lot, they might not be seeing the same primary care provider. They might be seeking out new doctors all the time. It's also linked to postponing needed medical care and medications. It's linked to increased emergency department usage and increased hospitalizations. And it's also associated with poor health among young children. Of course, if you're spending too much on housing, you're probably you're not spending enough on other things that you need. So spending too much on housing can cause food insecurity and lead families to decrease expenditures on health promoting activities such as healthy eating, exercise, preventative care, and to postpone medical or dental care. There was a recent survey by Enterprise Community Partners that found that among severely cost-burdened survey respondents who spent more than 50% of their income on rent, 83% of them were prioritizing paying rent before anything else, compared with 1% who prioritized healthcare costs. So if you have a choice between paying rent and paying healthcare costs, most people are paying rent. Which in some ways is good if it means that folks aren't moving around, that they have a roof above their head. But if they're postponing needed medical care, that's obviously a bad thing. As you've guessed, not having enough money to pay rent or being behind on payments can also have negative mental health outcomes. So a 2012 study found that people who were behind on their rent or mortgage payments or were in foreclosure were more likely to meet the criteria for depression, had a higher likelihood of reporting fair or poor health on surveys, and were more likely to have had a recent anxiety attack. And lastly, what do you do when you need a place to live, but you can't find an affordable place? You might get a really cheap place that is of poor quality or not very well maintained, or in a neighborhood with fewer opportunities. Or you might move in with someone else for a bit. So of course, as we know, poor housing quality is associated with poor respiratory health and high rates of asthma, morbidity among the elderly, lead poisoning among children, and crowding. There's been a bunch of research on crowding lately, can increase the spread of infectious diseases and cause negative mental health. There's also been a lot of research lately that shows that crowding in homes is linked to poorer educational outcomes among children. So now let's switch over to our next policy domain. I picked neighborhood and community design as our second one to focus on because I've seen a lot of places around the country and even around the world that are really working to improve this element of the built environment. So I'd like you to go back to the Jamboard and find the frames that have the question, how do you think neighborhood and community design influence people's health? And if we could share the Jamboard one more time, that would be great. And just as a prompt, I would encourage some of you to think about what were some of the neighborhood and community design things that you saw pop up during the pandemic? There were a lot of really interesting things that cities were trying to do with neighborhood and community design. All right, natural meeting spaces, absolutely. Access to walkable areas, yes. Neighborhoods can promote exercise like walking or biking. Great. Food access, community gardens, yes. Having close, oops, can't see that one. Can help or hinder use of healthy transportation. Yep. Close access to grocery stores or farmers markets, better infrastructure. Wonderful. Close proximity, apartment complexes. Yep. Promoting exercise. Great. Unsafe intersections without controls or hazardous, absolutely. Replaced parking spots with parklets. Yep, that was one of the things we saw a lot during the pandemic was cities rethinking how to use outdoor space to really promote social interaction. Excellent. Abandoned buildings harbor vermin and other dangerous substances or are a place for illegal activities. Absolutely. I feel like you all have seen my slides already because you are right on the money with these. Great. So neighborhood and community design, again, we'll start with the different types of interventions within this policy domain. And again, this is how we grouped them in our research, but you might see them grouped differently. So we identified the following interventions or elements that make up neighborhood and community design. So first, how design makes it easier or more difficult to access community assets like places of employment, shops, restaurants, entertainment, community centers, and other social gathering spaces. Physical activity and active mobility options like bike routes, parks and open spaces, sidewalks, and good public transit. Perception of safety, so low levels of car traffic, good street lighting, and crime preventative infrastructure. And finally, attractiveness of the neighborhood. So this includes things like how much neighbors upkeep their lots, how much the city keeps up appearances of a neighborhood, and how much greenery, trees, flowers, that sort of thing are in the neighborhood. So again, we'll start with our first category. So access to community assets. So as I said, these can be things like parks, green space, gathering spaces, shops, jobs, entertainment. All of that can cause you to participate more in social activities if that stuff is really easy to get to. It can also make it easier for you to become aware of what health and well-being programs are available in your community. If you're near those things, it's easier to see, hey, there's a class happening later today, or there's a grocery store nearby if you're able to just walk past it on your way home from work. And then also, of course, thinking about walkability. So having all of this near you can make it easier for you to walk places versus taking your car everywhere. And certain types of design will really make you want to leave your house less and take your car everywhere. So having either good or bad access to community assets can really influence mental health, your physical health, and make it easier or more difficult for you to get healthcare when you need it or provide or find other health promoting resources. So good neighborhood and community design can also promote more physical activity, as many of you said in the Jamboard, and really encourage you to use active mobility options like walking and biking. There's a lot of growing evidence that community design elements that promote walkability and transit-oriented development are also connected to increased social capital, connections with neighbors, and better mental health, of course, also promoting physical activity and physical health. So how a neighborhood is designed can also influence whether or not someone feels safe in their neighborhood. So for example, community design influences car traffic, how easily cars are able to get around, how safe pedestrians are when they're trying to get around. So that's hugely important. You've probably heard of Vision Zero plans in a lot of cities that are really trying to figure out how do we redesign spaces so that pedestrians are at the center of our cities, at the center of our plans, not cars, and really trying to work to reduce the number of automobile accidents down to 0. Thank you, Susie, for putting, oh, I don't think that's the right link, but, but I like the idea. I appreciate you sharing. So car traffic, yes. And then also, of course, where street lighting is placed influences how safe someone feels. You know, as I said already, street design, and then crime preventative infrastructure. So all of this can have some of the same health impacts that we've seen before, you know, promoting physical activity, promoting social capital and people interacting with their neighbors, either promoting or hindering mental health, and also can lead to either more or less accidents and injury and violence. So lastly, how attractive a neighborhood is can also influence health. This one was kind of interesting and was new to me. But attractiveness, of course, is how well neighbors keep up their properties, the amount of trees and flowers somewhere, and whether there's blight in a neighborhood. And so just as one example, in a study of Northern California neighborhood design features, attractiveness actually had the strongest relationship with an increase in physical activity. So the neighborhoods that were more attractive looking had a higher amount of physical activity in them. And that actually might seem quite obvious when you think about it. But again, when you're thinking about how do you promote positive public health, maybe the first thing you think is not how do we make neighborhoods more attractive. So I thought that was kind of interesting. And again, here are some of the health impacts of attractiveness of a neighborhood. So from there, I wanted to talk, you said this seems to be focused on urban and suburban. How does this information relate to rural areas? That's a great question, Francie. I wonder if we could save that one, make a note of it, and I'd love to talk about that more at the end of the presentation. So I want to turn to health equity for a minute, because as I'm sure you're all very aware by now, there are a lot of health inequities in our community that are caused by different policies, laws, and different levels of investment that decide how the built environment looks in each neighborhood. So in our research, we define health equity as, when all people have an equal opportunity to be as healthy as possible. Of course, many factors contribute to health equity, including equitable investment in communities, especially in health and well-being, and wealth building amenities, programs, equitable investment and creation of health resources and supports for different populations, and access to health and medical services. And as you all know, poverty, racism, and discrimination are barriers to achieving health equity. So we're going to watch a short little video. Hopefully, again, this might be something you know already, what's the difference between equity and equality, but I think this is a great short little video, so I'm going to play this for you.
Today, we are talking about equity and equality. But you might be wondering, wait, aren't these the same thing? They look the same, they sound similar, so aren't they the same? No, in fact, they're really different concepts, even though a lot of us get the two confused. So let's break them down. You probably already know what we mean when we say equality. We're talking about two things that are the same or have a similar value. When we treat two people or two groups of people equally, we make sure that they have or get the same things. For example, if I want to give Betty some apples, then I need to give Ben the same number of apples to treat them with equality. Along the same lines, if I want to give the nursing program a budget increase, then I need to make sure that I give the culinary arts program the same budget increase to treat them with equality. That makes sense. But that's not the same thing as equity. Equity can be defined as giving everyone what they need to be successful. In other words, it's not giving everyone the exact same thing. And here's where the difference between equity and equality really come in, because it's important to remember that if we give everyone the exact same thing, expecting that will make people equal, it assumes that everyone started out in the same place. So here's an example. In this instance, we give everyone the exact same box. We treat them with equality so that they can see over the fence. Well, that's great for the person on the left because they were already taller, but it's not so great for the person on the right who still can't see over the fence. From an equity perspective, we wouldn't want everyone to have the same size box because everyone isn't the same height to start out with. With an equity mindset, we would get everyone what they need to raise them up to the same level. Here's another example. With equality in mind, we can treat everyone the same and give them all the same bike, but that doesn't really help the person on the left who can't ride that kind of bike, or the person in the middle that is too small for that bike. So when we think about this situation with equity in mind, equity tells us that we need to give everybody a different kind of bike so they can all enjoy a bike ride. As you might guess, this is where the concept of fairness gets tricky for some folks. We often think that being fair means that everybody gets the same thing, and that's what we were taught when we were growing up. But fairness really only works when we're all the same to start out with. So this is a new idea for many of us to think about. There is this great American saying that people just need to work hard enough and pull themselves up by their own bootstraps. It's this idea that everyone can be successful if you just work hard enough. Well, that's a lot easier to do when some of us were born with longer arms to pull up those bootstraps, or maybe we were given longer bootstraps when we bought our boots. So let's think about moving away from the bootstrap idea and instead think about shoes. There is a quote by Naheed Dasani that goes, "Equality is giving everyone a shoe, but equity is giving everyone a shoe that fits."
All right, so as you saw in the video, equity is when everyone gets what they need to achieve the same outcomes, recognizing that some people may need more and some less. So when that doesn't happen, we get disparities, which is when a group of people experience a larger share or higher burden of a problem. In this case, we're talking about health challenges relative to another group. So what are the causes of health disparities? So in the Jamboard, I know my slide looks a little funny right now, but I'll reveal it in just a moment. And if you could go back to the Jamboard, find the right slide that talks about health disparities, and go ahead and put in some ideas about what causes health disparities in our community. So you should be on slides 10, 11, or 12, depending on what your last name is. Lack of insurance is one answer I see. Access, generational wealth, that's a great one. Lack of access, education, income, healthcare, social support, lack of a support network, language barriers, access to care and income. Education, employment, poor health knowledge, lack of hospitals and healthcare facility. Yep. Lack of expertise from health professionals and cultural barriers. That's a really important one. Great. So as some of you have said, so some of the common disparities that occur that influence health are access to healthcare and the quality of that care, housing and neighborhood quality, access to health promoting amenities like clinics, hospitals, trails, and grocery stores, environmental quality, and school quality. And what are the root causes of those disparities? And I should say this is not a comprehensive list, but as I was thinking about what are the root causes of these disparities in the built environment, I think of things like zoning policies, redlining, racism and discrimination, lack of knowledge about different people's needs, conditions, and circumstances, and of course, I'm sure you all have heard about or seen situations where someone's lack of knowledge, particularly on behalf of a healthcare professional, might lead to poor treatment or lead to mistreatment of an illness, and of course, low levels of investment. So I wanted to talk a little bit more about zoning today and redlining, because these two have had such a huge effect on how our neighborhoods and cities are designed in the United States. So we'll start with zoning. Zoning, as I'm sure many of you are aware, is a way for urban planners to divide the land in a city up by a specific use. So zoning decisions are found in zoning codes that say what kinds of things can be built where. So just to keep this example simple, we'll say that there are 4 main zoning types: residential, commercial, industrial, and recreational. Of course, within each type, there are more zoning types within those, but I'll just show you something we often see for residential is with an area that is zoned residential, which means that that area is predominantly for housing. You can have single family zoning. You can have duplexes allowed, you can have apartment buildings, and you can also have zoning codes that say mixed use in a particular area. So for example, you can have housing and businesses in one zone. So here's an example of a basic zoning map that I found. Like I said, it's pretty simple. Most zoning maps, as Susie can tell you, are much more complicated, but can be interesting to look at. I found this on the City of Fort Worth's website. So as you can see in the image, the land in the graphic is divided into single family residential, commercial, multifamily residential, and open space. So again, like I said, super basic example, but just wanted to show you if you've never seen a zoning map before. So zoning specifically can impact health in several ways, both negative and positive. Initially, zoning was designed to be a tool to promote positive public health. So when zoning laws and zoning codes first came to be, they were designed to prevent overcrowding and prevent people from living too close to pollution caused by industrial uses. Zoning also controls density, or how many people live in one place. So zoning that allows for multifamily and mixed uses and denser neighborhoods can promote more walking and less driving. We also have something called exclusionary zoning, which is the laws that place restrictions on the types of homes or other types of buildings that can be built in a particular neighborhood. So some common examples of exclusionary zoning policies are ones that say, that have a minimum lot size requirement. So say you can't build on this lot unless it's of a certain size, that have minimum square footage requirements. There's some exclusionary zoning policies that prohibit multifamily homes and limit the height of buildings. So as an example, in Washington, DC, buildings are not allowed to be taller than 12 stories tall, which means that it's very difficult for DC to build taller residential buildings to create more housing for residents. Thank you for sharing that article. So the origins of these laws, as I said, date back to the 19th century, where many cities were really concerned about fire hazards and light and air regulations. But in the subsequent decades, many zoning laws were used to discriminate against people of color and maintain property prices in suburban and more recently in urban neighborhoods. So before 1917, race-based zoning was legal. And again, remember that zoning is a government tool. And so as you might guess, race-based zoning is when zoning laws limit certain groups of people from living in certain places based on their race or ethnicity. And in many cases, race-based zoning also limited different racial groups from mixing with one another. And these were ruled to be illegal in 1917 in Buchanan v. Worley. However, the impacts of many of these policies still exist. And then another important thing to think about for how zoning impacts health is that restrictive zoning limits. So for example, only zoning for single family uses really limits the housing supply, which, as you know, makes housing more expensive, limits choices about where people can live, exacerbates segregation, and encourages more car use. So that is definitely a negative, creates negative health outcomes. We know that when people have fewer choices, when housing is too expensive and they have to buy more, try to find inexpensive housing, they might look for lower quality housing or spend way too much money on housing and not enough on other important health impacts. So another concept I wanted to talk about today was redlining. So redlining was a tool used by government insured mortgage lenders like the Homeowners Loan Corporation. It was a way to promote homeownership and prevent foreclosure after the Depression. And the government offered government insured mortgages to people who wanted to buy their home. So it sounds great. However, of course, the government wanted to vet which properties and homeowners would be good for this program. So they developed these color-coded maps ranking the loan worthiness of neighborhoods in more than 200 cities and towns across the United States. So I know that not all of you are located in Dallas, but I did find this redlined map of Dallas from 1937 to show you an example. So for those of you who've never seen a redlined map like this before, the areas that are color-coded in green meant that they were the best places for lending. Blue was labeled as still desirable. Yellow was labeled as definitely declining, and red was labeled as hazardous. And that's where the term redlining came from. And as you might imagine, a lot of these color codes were drawn around places where people of specific racial groups live. So most often the neighborhoods that are green and blue are predominantly white and wealthier neighborhoods. So maybe you're thinking, okay, that was a long time ago. This isn't an issue anymore. Well, let's take a look at how redlining has impacted the way that Dallas looks today. So I found this map that was created by the National Community Reinvestment Coalition. And basically what they did is they took that map that we were just looking at and they added current economic and demographic data on top of it. So the gray areas that are outlined in dashes are where the majority of residents were minorities as of 2010, the 2010 US Census. So the dots mark places where the 2015 median family income was below 80%. So basically all the places with the dots and dash lines are majority minority or low income. So in the chat, go ahead and just use our chat here. You don't have to go to the Jamboard. Can you put down a note of what you see in this slide? Just remember that green meant best places for lending, blue was still desirable, red and yellow were labeled as bad places to lend. What is it that you see? Not much has changed. Green stays best, red downtown is now high fashion. Interesting. Anybody else? Wealth equals health, absolutely. What else? So what I see in this map is, yep, green and blue closer to park and water. That's an interesting observation, yeah. County hospital is in a red zone. That's interesting. Green and blue away from industry. So what I saw when I looked at this is that, yep, city of Dallas and downtown still represents minority and low income families, a lot of yellow. Fabiola, that's interesting. So most of the places that were graded as yellow, declining, or red hazardous are still predominantly inhabited by people of color and people with low incomes today. And the places that were graded as best and most desirable, the green and the blue places, are mostly inhabited by wealthier people and are majority white today. So I thought this was interesting. And I think really just drives home the point that past redlining, current zoning policy, and past and current inequitable investments, past and current racism, And discrimination in health and urban planning leads to how our neighborhoods are now. So one note that I wanted to add as well is that although all of the policies I mentioned disproportionately impact people of color and people with low incomes, they impact nearly everybody as well. So even white people, because all of these negative impacts drive up housing costs for everyone, drive up transportation costs for everyone, and can create more air pollution, which of course harms everybody. So this is not just for people of color to worry about, this is for white people to worry about as well. So I just wanted to quickly go back to the two built environment policy domains we talked about before. So how do all of these things, zoning, redlining, racism, discrimination, and lack of investment impact housing equity? So because of these policies, predatory mortgage lending, exclusionary zoning, people of color are more likely to live in worse housing conditions and have a hard time finding affordable housing, and therefore spend less money on food, utilities, and medical care or other necessary home repairs. And similarly, how do these things impact neighborhood and community design equity? So because of these policies, people of color are more likely to live in less desirable neighborhoods with higher environmental health risks, more blight and fewer health promoting amenities, live in segregated neighborhoods, and have worse access to health promoting amenities. And I'm sure you're guessing countless studies show this. You can see in this slide just a couple examples of headlines in the news over the last, I think all of these are from the last year, that show how this is happening in our country. So with that, I just wanted to take a quick pause and say, I know some of this is heavy, and many of you might know about a lot of these health inequities already, but just wanted to make sure I'm giving all of us a chance to process some of the information. In a moment, I'm going to present some really tangible ways that you can take action on some of the issues we've talked about. But first, I just wanted to take a moment and give folks a chance to share how you're feeling. So if you feel comfortable in the chat, go ahead and share a few words. It's okay if you're thinking, oh man, I wish I hadn't come to this presentation. This is depressing. I'm feeling sad, or maybe you're feeling motivated to take action. So I'll just give you a moment if you could share in the chat how you're feeling learning all of this. Sad, yep, Zoom fatigue. I know it's a lot, and I appreciate you all for being here today. Sometimes the topics feel overwhelming, not surprised, need for advocacy. Yeah, thank you for those of you who are sharing your feelings. We appreciate that. It's good to be aware. Thank you, Sophie. So yeah, of course, I'm hoping to share this with you so that you can take action. So on that, I'm actually going to skip the next activity just to make sure that I have enough time to answer questions from all of you, but did just want to share this brief example thinking about college campuses and health. These pictures on my slide just show just a couple ways that college campuses in specific impact people's health. So, and I know not all of you live on a college campus, but I'm guessing most of you have visited college campuses at some point. So hopefully this still applies to you. But for this first one on air quality, this study found that many colleges have had issues with mold. So you might not think about it, but college campuses are actually some of the biggest property owners in certain cities. So when students live in on-campus housing, the university serves as the landlord and sets the terms and the costs of housing. So for many students, as we've talked about, poor indoor air quality in on-campus housing is causing physical health problems. And many dorm rooms have air quality issues because of aging buildings that with limited airflow. Another thing that college campuses can do is they can also provide critical housing for students experiencing homelessness and housing instability. So as we know, having stable housing can lead to increases in positive physical and mental health outcomes. So that can be a really great way that colleges can help to promote better health. However, to do that, colleges need to pay close attention to housing costs for on-campus and off-campus housing and help students at risk of homelessness or housing instability to help them find affordable or free housing. And this last study from Germany, the researcher talks about how universities offer a lot of potential for improving public health of their staff and students by providing more green spaces. And so it talks about how a healthy learning and working environment should support people in maintaining an appropriate balance between coping with pressure and stressful situations and ensuring periods of rest. So green space can be a place for physical activity, recreation, a place of identity and gathering, and also a place where students and faculty can just take a break, take a rest, and reduce mental and attention fatigue. So I know I've been talking for a really long time, just a few more slides, but I just want to say I appreciate your continued attention. For the final part of my presentation, I wanted to bring this back to all of you and what you can do in your professional capacity, in your role as a student, or just as a city resident to impact built environment decisions to promote better health. So let's say that you want to be a nurse, a doctor, or a medical professional. So what can you do? One of the things is that in your work, again, I know some of you are students, so keep this in mind for later when you become a nurse or a doctor or medical professional. Of course, as you're diagnosing and treating patients, it will be really important to think about how the social determinants of health might have caused some of the health challenges that you see in your patients, and how the social determinants of health might influence the treatments that you're prescribing. So some examples I've seen of this are people in the medical professions incorporating knowledge about social determinants of health in their work. So I've seen people using screening tools that ask patients about their housing, their income, where they live. You might also work to learn more about common health disparities in your community. So one way you can do this is by looking at community health needs assessments. So this is a document that is required by the Affordable Care Act for all nonprofit hospitals. They have to complete one every 3 years, and it can be a great place to go and learn about community health challenges. And also just talking to your local county health department and consulting plans that they have. So just to show you what one of these looks like, I Googled for one in Denton. I've easily found this community health needs assessment done by Texas Health Presbyterian. And on page 15 of the report, there we have it, social determinants of health. So they have some information about how the social determinants of health are impacting people in Denton. The one thing I was a little sad to see was that it doesn't talk about housing, which is a bit of a bummer since that's a pretty big one. One other cool thing that you may not be aware of is how hospitals and healthcare systems are getting involved in the social determinants of health and in housing in particular. So many hospitals are actually starting to invest in housing. And this is because of growing awareness about the social determinants of health and hospitals really starting to think of their role not just as places that treat health, but that have an overall mission to improve health. And even if that means, working on the more upstream factors that influence people's health. So hospitals and healthcare systems are really starting to invest in creating more affordable housing. And I think it's super interesting. I would definitely keep an eye on the news for stuff like this. Then for the urban planner, local government folks out there, how can you incorporate health into your built environment work? So to start with, you should definitely research the history of redlining or zoning decisions in your community, see how investments and infrastructure have gone, where money is being sent to, what neighborhoods are prioritized, talk to residents in your community about their experience. You might then try to rezone areas to allow for more density and more affordable housing and walkability. You should also look at the community health needs assessments done by local hospitals and try to build in health promoting infrastructure into city plans. and of course, designing spaces for positive physical and mental health. And then if you're a college student or faculty member, you should advocate the Vice President of Student Life, the Student Region, or the Board of Regents for more health promoting amenities. You can talk to members of this committee, the Build Well Committee of the Health and Wellbeing Initiative, about how you can get involved in campus, or join a student or faculty association that advocates for good built environment policy. You also, I think, have an obligation to really think about how your campus or your university has influenced the surrounding communities. I'm sure you've heard about a lot of schools across the country where the university does not have a great relationship with the surrounding community, and it has harmed the health and well-being of residents in those neighborhoods. So I encourage you to reflect on your university's history and relationships with the surrounding community, as these can help to promote or hinder health. And then lastly, as a city or county resident, you can write your elected officials. You can show up at zoning board meetings or city council meetings. You can vote, attend participatory planning activities. You should definitely use your local built environment amenities. Ask for them if you don't have them. Tell your elected officials that you like them if you do use them a lot, and join a professional association or local group that advocates for good built environment policy. So I think I've spent enough time talking to you all, but if you think this is like the coolest stuff ever, you want to learn more, I encourage you to check out some of these papers that I've wrote. This slide presentation, The Role of Race in Zoning, is by my colleague, Yona Freemark. It's a pretty amazing presentation if you're just looking to learn more about the history of zoning policy. The Urban Institute also has a great website called Housing Matters, which is a wealth of information on how housing matters in our life. So with that, I'll just say thank you. And again, just really appreciate you all for being here today.
Thank you so much, Martha, for this incredibly interesting lecture and in its comprehensiveness. We want to turn to you all in the audience right now and see if, in listening to what Martha had to say, you had any questions that came up in your mind. So feel free to enter those questions into the chat. I know Francie Baxter had a question earlier, and that might be a good one to get us all going. She said that this seems to be focused on urban and suburban areas. And how does this information, how does what you've talked about today translate to rural areas?
That's a great question. So thank you for that, Francie. Although public transportation is, not as common in rural areas, it does still exist in some areas. There are, rideshare options and other ways that people can get to work more easily and reduce car traffic. And I've seen more rural areas that are starting to think about how to improve public transportation and ride sharing options to reduce pollution and car use. Housing quality and cost is definitely still a concern in rural areas, especially making sure that housing is of good quality and affordable to folks. Just because it's in a rural area does not mean that it's affordable, especially when you factor in land costs and repairs. I've seen a lot of research lately that talks about how of all the areas, urban, suburban, and rural, the rural area is actually the place where housing repairs are most needed in the United States, and not enough funds are being allocated to improving housing quality and making needed repairs for folks who live in rural areas. So that's a huge one. And then the other one I guess I would point to as being really important is infrastructure. So I'm sure how important clean water access is, especially for folks in rural areas, folks that live on Native American reservations. Getting clean water access is a huge challenge in the built environment there. So you're right that some of these apply a little bit less than others, but I think are still pretty important for folks in rural areas.
Thanks for that. Francie, does that answer? I hope that answers your question. In the meantime, Pushkala Raman has a question on whether or not you have any data or information on what's happening on this issue in other countries. She says that one of the phenomena of urban development that she's noticed in India is that traditionally we've had a lot of the community features you've mentioned to encourage people talking, green spaces, etc. But newer developments are built more on the Western model of reliance on vehicles, the fewer meeting spaces, and so on. And I think Pushkala is wondering if that is something that you've seen in other countries as well.
Yeah, that's a great question. We did not study international environments for this particular paper, but I think it's really important, especially as the United States tries to promote walkability and reduce the use of cars. There's obviously a lot of other countries around the world that have done this successfully, and I think the United States should look to those countries for models. And even I think a lot of countries that have way better models of having community gathering spaces and things like that. So I think, you know, each country, of course, is very different, and people use spaces in different ways and have different opportunities and challenges in getting to public spaces and using public transportation or accessing green space. So I don't know if I have any specific data on what places are trying, although I think generally a lot of places are really thinking about that neighborhood and community design piece and how to kind of promote more social cohesion and create gathering spaces and also just reduce vehicle emissions and traffic fatalities.
Thanks. Let's see if we have any other questions. Norlin asked whether you have any recommended learning activities for students. That is actually something that we're going to focus on at next Tuesday events. Next Tuesday's event at the workshop we're hosting on April 26th. That will be an opportunity for us all, it's from 4 to 6 p.m. for us all to practically engage with what Martha talked about today and evaluate some of this impact of the built environment on your health and your wellness as it plays out here on the ground in Denton. So we hope to see many of you who are in attendance today there as well next week, so we can take it to the streets.
I love that you guys are doing that. I'll just say, when I was living in Morocco, I did an activity with my students there where I divided the group up into 2 groups, boys and girls, and asked them to draw their community and then use different colors and symbols to represent places on their maps where they felt safe in their neighborhood, places where they felt unsafe, places they liked to gather and hang out with friends. And then we talked about those, and it was really revealing, especially as in a place like Morocco, gender creates a lot of differences in terms of how people use spaces. And I think it was important to separate them out to think about what each gender group really needs from, you know, the built environment and from their community. That's just one example of something you can do.
Yeah, I think that's a great example. Are there any other questions from the audience while we have y'all here? I don't see any more questions, so I don't know if either Susie or Michelle want to speak some final words and promote any other activities or venues.
We Health and Wellbeing is celebrating Earth Day as Earth Month. So if you follow us on social media, you can kind of keep up to date on some of the featured events that we'll have over the next few weeks. We really appreciate your time, and Martha, we appreciate the outstanding presentation.
Thank you for having me.
Thank you all so much for attending, and we hope to see many of you next week. The link to sign up for next week's workshop is in the chat. Michelle posted it. It's a link to a Google form, but just in case, I'll post it again. Yeah, thank you all for being here, and I hope you learned something interesting.